Okay, I'm going to show you how to tape for patellofemoral joint dysfunction. So for a lot of you out there working with athletes with knee pain, one of the most common dysfunctions you'll see is the patellofemoral joint syndrome, which is essentially a patella tracking issue. Now, it comes in all different shapes and sizes. A lot of the time, I suppose, the bread and butter scenario with this condition is the fact that the patella itself obviously gets dragged into that lateral position, and unfortunately we get that retropatellar pain, which is underneath the kneecap because of the condylar surfaces grinding together, which is not ideal. Part of that can be because of, obviously we've explored the hip protocol that I've done before and so forth with you all, but that can be because the rec fem is quite tight, and there's obviously going to be some issues with that because your clients, when especially in this position, kneeling, because the rec fem will be tight, it'll push the kneecap back up into that those condylar surfaces. It's not ideal. So this taping technique is quite simple. It's just a matter of lifting and then obviously correcting where that patella will sit. So we're going to need 2 pieces of tape. Okay, obviously we're using rock tape today. First, we just need a really small piece here. Obviously we'll round the edges off here, and that's going to sit directly underneath the knee itself. Then we're going to have a thicker piece here, okay, the 10 centimetre here, and obviously the idea is that we put a split right down the middle, so probably only about 1 inch from the end of it, okay. So the idea with this is that we'll peel, okay, around the knee itself. Okay, so we'll place the first strip. So remember, we're going to tear from the middle, peel back the edges, okay, like so. And then you're going to hold the ends. Now, this is going to be on about 80% of the stretch. So if that's 100, we're breaking that back about 20%, so that should be about 80. I'm going to place that directly underneath the patella itself. Okay, so like so. Okay, give it a bit of a rub to adhere. Adhere, blend off the edges. Okay, so that's our decompression. The second part will be this longer piece here. Now, what we need to do here is we have to make sure that we measure about 3 finger widths above the knee itself. That's where the split is going to go. So make sure that that split will go about 3 finger widths above, okay? Really, really important. Otherwise, you're going to end up really close to the knee and you'll tape straight over the top of the patella, and then you won't get that lifting and that correcting. Okay, so once again, let's just tear 2 of the tail pieces. We will then peel off the backing for the anchor. Make sure that you don't stick yourself to the tape. Remember, 3 finger widths above. Okay. Place that down. That will be your anchor. So there's no stretch on that whatsoever. So now you're free to apply the tails. Now, the 2 tails, flick them up. Let's do the medial first. Now this medial one is to go on about 40% of stretch. So if that's 100, that'll be about 40, and it's just going to wrap around the knee itself. Okay, so around the patella and across like so. The next one is going to be on 60% because obviously we're wanting to bring the kneecap back in. So that's 100, that'll be about 60 there. So what you should see, if you've done it correctly, is that one side should be slightly longer than the other because you've got more tension on the tape. Okay, so simply that's what you're looking for here. If you bring the knee up, what you should start to see is almost like a granny knee, so that crinkling in the knee skin itself, and that will give us the indication that we're actually lifting and offloading it. So that's patellofemoral joint.